Liz. Thanks for coming into the office today. My name is Courtney. I'm going to be your nurse practitioner today, seeing your son Xavier. So I'm a family nurse practitioner. I see pediatric patients and adult patients, and we're going to work on Xavier's asthma today. So it sounds like you brought him into the office today for kind of some worsening symptoms of asthma. So it looks like here from the intake that the medical assistant brought in that Xavier's been having symptoms of asthma since he was about 2 years old. And if I check my notes here, so he's started having symptoms when he was 2. He's a 5-year-old male. Started having symptoms when he was 2. Sounds like right now you guys take Zyrtec and then kind of use albuterol as needed, but that's not working quite the same as it was before. And so based on your intake information, it looks like we're going to call what he's experiencing is a moderate persistent. That's the severity of asthma that he's experiencing. So it sounds like he's waking up about once a week from having coughing fits, coming into your room, asking for his inhaler. He's having some limitations with activity. So at school, he's maybe stopping playing at recess, still playing but stopping maybe halfway through. Or it sounds like when he's at Sunday school, he participates a little bit but gets tired and has some shortness of breath and comes and gets you from your class to help with his inhaler. And then it sounds like you guys are using the inhaler about once daily. And so based on that criteria, we're going to put him in the persistent moderate category. And so currently using your short-acting inhaler, or the albuterol, that's not giving you guys quite enough control. So I think what we'll do is we're going to step you up to a level 3 or a step 3. And studies show that kids who are on a step 3 do really well if they have a LABA is the short term for it, or long-acting beta agonist, and certainly you don't need to remember that, and a leukotriene receptor agonist, or an LTRA. And those are kind of some long fancy words, and what we're going to do is we're going to create an action plan, an asthma action plan. And what that asthma action plan will do is it will help you be able to help Xavier here manage his asthma at home. And Xavier is 5, and so we can start showing him, kind of how to stay in the green. We all know green means go, yellow means kind of slow down or take caution, and red means stop. So when we're in the green, that's good. That's what we're going to try to add these medications on. When we're in the yellow, that means we need to increase some medications or add some medications on. And we're in the red, that means that we need to take action immediately. And we're going to kind of talk about that a little bit more. So what does being in the green mean for the action plan? And I'll show you guys this. You guys have a copy here that you're looking at yourself. So at the top of it, you can see kind of some information, and there's the office number, my name, Xavier's name, Liz, your name, and then also the effective date. And that effective date is going to be good for 6 months. So in 6 months, we'll see you guys back in the office for a follow-up visit to make sure that this plan is working and that we're having really good control and that we're not needing to go into the yellow that often. And certainly we want to try to stay out of the red if possible. So also we'll have this printed out, and there's also an emergency contact number on there, and that's good to have a grandparent, an aunt, an uncle, somebody who's reliable that could help with an emergency. So this asthma action plan would be great to have to give to school, Sunday school, daycare, any activities that Xavier were to go to, so that everybody, all of the adults in his life, could help you manage your asthma, Xavier. So what does this look like? So we started at the green. This means that you're breathing really good, Xavier. You're not coughing. You don't have any of that wheezing or high-pitched breath, and you're sleeping through the night, and you can work and you can play. And so that's green. And then yellow is any symptoms that are different than that. So these would be when you're having exposures or triggers. And from your intake, it looks like Liz already told us what some triggers were, which were from June to August. The allergies are a bit worse. And from anytime Xavier gets a cold or anything like that, it gets worse. And anytime he has like an upper respiratory infection, those are kind of some known triggers for Xavier. And so that would be when you're into yellow. And so maybe between June and August, when Xavier has extra triggers, pollen's really high, ragweed, those kinds of things that you identified as known triggers on your intake form. When those things are worse, you're going to want to start your yellow medications or your kind of like caution medications or trigger medications, and we'll talk about those meds here in a minute. And then red is where you're in an exacerbation, where the medication's not working, you're trying the albuterol, that's not working, breathing is hard, it's fast, maybe you're retracting a little bit, having a hard time with that kind of stuff. And that's when we want to try to use our red medications. If those do not work, you want to call the office immediately, or if you're worried about if he's unable to talk or breathe while he's walking, unable to talk, breathe while he's talking, you'll want to go directly to the emergency room or call 911. And we were going to try really hard not to go in there. And so I know, Xavier, that you guys have kind of done the peak flow meter before, and we'll make sure that you guys have a nice working one for at home. And it looks like his personal best is around 174-ish. And so green is going to be anytime your peak is above 139. So anytime he blows into his flow meter and he gets 139 or higher, we're in the green, and that's good. And it's good to kind of, you guys can get a journal, a notebook, anything, paper, pen, and just kind of map that out. It doesn't need to be anything fancy, just kind of jot those numbers down. If you remember to do it most days, great. You don't necessarily need to do it every single day. I know it's kind of hard to remember. Kind of make it a game, make it fun, and just kind of play with it that way. When your peak flow volumes are between 139 and 87, then that means that you're in your yellow zone, and that's 80% to 50%. And that's really where we want to start using those extra medications that we'll talk about. And then when you're in the red zone, anything under 86 is when, for that peak flow, is when you want to definitely initiate the red. And you'll know based on his symptoms that he's not feeling well. So if you get kind of tripped up in those numbers, don't worry about that. But really, we want to go based on symptoms, how he's feeling, and if he's functioning in activities. So, so the peak flow volume, or the peak flow meter, something we can kind of review, is you get the peak flow meter, and then Xavier, if you want to just pay really close attention right now, what you're going to do is you're going to take your peak flow meter and you're going to put your mouth around it. You're going to inhale, and then you're going to do a fast exhale. And that's going to be your peak flow number. And you're going to get a personal best, and then these numbers that I have on your asthma action plan are kind of based off that personal best. And on your intake form, it looks like it was 174-ish. Based on his height, that's an average number for him to have, so that's great. So green medications. So medications that will start today, which will be new for him to start this kind of new action plan that'll go for the next 6 months, and then we'll review in 6 months to see how it's working. We're going to start with Singulair or Montelukast, and Singulair is the brand name, so the generic form will be what's on your bottle. So I have that on the action plan. It's Montelukast, and it's by mouth. It's one pill, and you take 5 milligrams by mouth daily, and it's given at bedtime. It can make kids kind of sleepy, so we want to make sure we're giving it at nighttime. One of the side effects is it can make kids kind of irritable, angry, or he could have other side effects from it. Certainly, if he's having any of those side effects, stop the medication, give the office a call the next day, and we'll kind of talk through adding something different. So that medication is in the class of the leukotriene receptor agonists, and it's one of them that you can use in addition to an inhaled glucocorticosteroid, which is just a fancy word for a steroid inside of your lungs. So we know we take steroids when our lungs aren't working orally. This is a way to inhale those steroids and kind of help your lungs function a little bit better by using an inhaled corticosteroid. And so an inhaled corticosteroid is when you're at the moderate level, which is where Xavier was based on his numbers. We want to do a low dose of that, and that's going to be fluticasone inhaler or Flovent inhaler, and it's going to be 2 puffs twice daily, so 2 puffs in the morning and then 2 puffs at night, so 4 total for the day. And you're going to do that every single day. So we're going to take the pill and do this kind of long-acting inhaler to see if that works. So we're going to think of the Flovent or the inhaled corticosteroid as kind of a long-term thing. It helps long-term, but it doesn't maybe necessarily help in that moment. So in that moment, we still want to make sure that we're using the short-acting inhaler, which is the albuterol. And that would be for physical activity, which you'll see on here. If he's having wheezing or shortness of breath during physical activity, he's going to want to use that inhaler. And like what you guys have been doing before, 2 puffs of that as needed for wheezing and shortness of breath. So then, okay, so for when he's in the green and we're doing those inhalers, we want to make sure that he's doing really good breaths of the medication, that he's getting all of the medication he needs. And what that looks like is using a spacer. I'm not sure if you guys have one of these at home. On the intake, it looked like you guys didn't have one. So we'll make sure that we get you guys one, and I'll show you how to use it. So you're going to attach your inhaler to the spacer, and it's basically this long tube. And you'll see a lot of people like take their inhaler and puff it and try to take a breath at the same time. Certainly that works if your breath is very coordinated with the medication, but a lot of times it doesn't happen, especially in kids. It can be difficult to coordinate that breath, especially if you're having a hard time breathing. It can be hard to kind of coordinate those two together. So we use a spacer, and what it does is it basically, you blow the medication into a chamber, and then your body can take the medication when you're ready. There's no coordination needed. And so you'll puff the medication in there, he'll take his breath, wait, and then you're gonna puff the medication in the spacer again, take his breath, and then hopefully that will give him some relief. Oh, excuse me, my computer's messing up here. So one of the things you want to keep in mind is washing that spacer, making sure that the spacer's clean, especially during times when there maybe is more viral stuff going on, bacterial stuff going on, upper URI stuff going on. We just want to make sure that spacer stays clean. And there's instructions for cleaning the spacer inside of the box on the instruction manual. And also, a lot of people just use soap, water, rinse it out, and then let it dry in a clean towel sitting on their counter. So that's going to be when we're in the green every day, kind of doing really well. Then when you're in the yellow is when we're going to add the albuterol. So that's when you're going to start albuterol, and you're going to kind of do albuterol on a more regular basis. And so what that means is you're going to use albuterol, excuse me while I pull this up here. You're going to use your albuterol inhaler again with the spacer, and you're going to do 2 puffs every 4 hours for wheezing and shortness of breath. You can also add on ipratropium or Atrovent is the other name for that. And you're going to take 2 puffs, and that's going to be every 6 hours. So there's 2 medications. First, you're going to try the albuterol, and then if that doesn't work, you're going to use the ipratropium inhaler, and then if that doesn't work and and the symptoms persist for 14 days after using those inhalers on a scheduled basis for 14 days, you're going to call the office, and we might need to start like oral steroid that would help with your lungs. Okay, so that's kind of the gist of it. Oh, and then in red. So the red zone is going to be where these medications aren't working, your breathing is just really challenging, you're having an acute kind of moment, and that's when we want to make sure that we're using the albuterol we can use it quickly in a row. So normally you're only going to take your albuterol, every 4 hours, 2 puffs every 4 hours. But when you're in an exacerbation, he's having a really hard time breathing, he's wheezing, retracting, all those things that are bad that we don't want to see our kids do. You want to put you want to give him an inhaler. You can give him 2 to 6 puffs every 20 minutes for the first 2 to 3 doses. And then if that doesn't work, then you'll want to make sure that you go to the ER, call the office, do one of those 2 things based on how he's doing. You can also use albuterol nebulizer if that seems to work a little bit better for him. And that's 2.5 milligrams every 20 minutes for 1 hour. And like I said, those are during the asthma attacks, or as healthcare providers say, acute exacerbation. And on the bottom here, I have listed some of the known triggers. So the triggers of where that we've already kind of noticed about that Xavier has, that's cold, flus, exercise or activity in kids, and then kind of plants, pollen, that kind of stuff, and wood smoke. So it sounds like you guys go camping a lot. So things that you guys can do is you could try some Zyrtec or Claritin, which it sounds like you guys are already taking, which is good during those times where the allergens are a little bit worse. That's one good way to avoid them. Staying away from kids who are sick with cold, flu, that kind of stuff. And for wood smoke, I know that you guys like to go camping, so kind of make it a game, having him try to avoid being directly in that campfire smoke as it kind of moves around the campfire. So those are all just kind of some things that will help. And then, as far as like trigger question goes, we've kind of answered a lot of those. You were telling me a lot of the triggers and the intake stuff.